Chief. I'm now very pleased to introduce our special guest. It's Dr. Kelly Grindrod, Associate Professor at the University of Waterloo School of Pharmacy, to our panel today. The School of Pharmacy is one of our key vaccine sites, and we're so happy that Dr. Grindrod could spare an hour of her busy day to tell us more about vaccines. She has been a regular participant and so dedicated in education and awareness as we've dealt with community leaders and different segments of our community. So Dr. Grindrod, thank you for all you do. Thank you for wedging us in amongst, I think you're at work today, as always. So please, the floor is yours, and I'm sure there'll be lots of questions. So welcome.
Thank you very much for having me. Yes, I'm happy to answer any questions. I thought what I'd start by doing is, as you see, I'm at the vaccine clinic. This is actually the waiting room. There's no one waiting just yet because we start vaccinating at 1 p.m. today. But I thought I'd take you through some of the most common questions that I'm getting. I've done a number of webinars in the region, all sorts of different populations, a lot of seniors groups, a lot of multi-ethnic groups, faith groups. And I would say that for the most part, the questions are the same. There's just subtle nuances that, for one population or another. So by far and away, the number one question that I've been getting is, when can I hug my grandkids again? I think I get that question more than any other question. And I just want to refer back to what Dr. Wong just said, which is that it's a funny time that we're in right now, where we're vaccinating the oldest in our population as one of the priority groups. And what that means is there's going to be an awful lot of vaccinated grandparents, but at the same time, the last people who are going to be vaccinated are children. So there's going to be a lot of unvaccinated children. And this is where this tension seems to lie, is that, people are vaccinated, they feel good, they even feel good the day they've been vaccinated, but what does that mean? So there's a few things to note here that I think the message maybe isn't necessarily being conveyed. A lot of people are saying it, and I think it's an important one to convey to people. But when you get one of these vaccines, whether it's the Pfizer or the Moderna, which are known as mRNA vaccines, or AstraZeneca, which is known as a viral vector vaccine, across the board, all are very effective at preventing severe illness, hospitalization, and death. And that's the goal. That is the goal of vaccinating people. What separates COVID from a cold is colds don't give you severe illness, hospitalization, and death. That's why COVID shut down the economy. COVID causes severe illness, hospitalization, and death. And that's why it's so dangerous to grandparents, for example. So the nice thing is, all of the vaccines that are approved in Canada, we think of some as being better than others, but all of them are really, really wonderfully effective for severe illness, hospitalization, and death. It doesn't happen right away, though, and no vaccine's 100%. And so what we try and do is we vaccinate the entire population, because you get a vaccine and the majority of people have a good response, but not everybody actually ends up immune. So we vaccinate the entire population by having the majority of people have immunity. Those who didn't develop immunity, this happens with like Hep B vaccines, for example, others, it's common. There's no community spread, and they're protected by the group. So right now we're in a very funny situation where we have a minority protected, not a majority protected. So the first thing people often don't realize is, you're hopeful when you get the vaccine that you're the one it works for, that you're the one that the immunity takes, but there's no guarantees. So you never know if you're the person it didn't work for. Also, the other one is it takes a while for it to work. So you get some immunity, pretty good immunity, about 2/3 of people, give or take, are protected after 2 to 3 weeks after they've had their first dose of their first vaccine. And those numbers, even after the first dose, appear to climb to the 80%, even almost as high as 90% after the first dose within about 4 to 6 weeks. That's a long time. And that's after Easter. So one of the big questions we're getting right now is, can I hug my grandkids at Easter? Can I see my grandkids at Easter? That's next weekend. The majority of people have not been vaccinated long enough to have that immunity, even if they were the ones who were lucky enough to actually have the immunity. So what happens with kids then? And I've learned this, grandparents care about grandkids. This is it, it's grandkids. So the thing to think about grandkids is, most kids, the trials were actually in the people over the age of 16 and over the age of 18. Pfizer was 16 and AstraZeneca and Moderna were over 18. So that means we know the vaccines are safe in those groups, but we're still waiting for research to be done on, there's trials underway right now for the 12-year-olds and up, which is great. And then we've just seen approval come through for the trials for 6-month-old and up. So we should see now in the spring and through the summer, data coming in telling us is the vaccine safe in children, but actually more importantly, what is the right dose that we give to children? That's the big question. What vaccine do the children get? What dose of the vaccine do children get? Optimistically, I sure hope that we start seeing them eligible for vaccines sometime in the summer. Might be late summer, might be fall. COVID research timelines move faster than any of us expect, so we don't really know. That, for the most part, is when you're looking really at whole populations being able to mask-free hug their grandkids. So hopefully what we'll see coming from the nationally, probably Public Health Agency of Canada, is some guidance in the coming weeks that just tells us, okay, so when you've got 2 adults who are vaccinated, how can they get together? If so it might be that grandparents can hug their adult children mask-free before they ever get a chance to hug their grandchildren. So, what are some other things, harm reduction things that can be done, whether it's hugging masked outside, for example, and we're going to look to see hopefully some good guidance coming through. There's a lot of pressure on various agencies to produce some useful information. So I think that's the number one question I'm getting is about hugging grandkids, because that's important. The other really important one that I'm getting is, what about AstraZeneca? If I have a choice, should I choose Pfizer, Moderna, or is it okay to get AstraZeneca? And I want to address this because AstraZeneca has been in the news almost constantly, it feels like, for the last couple of weeks. And there's a whole bunch of reasons for this. A lot of it actually has a lot more to do with AstraZeneca, the company, and how it talks about the vaccine than the actual research about the vaccine. The vaccine itself is safe and effective. The vaccine itself actually does a very, very good job at protecting against severe illness, hospitalization, and death. And actually, for those outcomes, it appears to be pretty much the same as Pfizer and Moderna. Now, you can't compare across them because there's no trials comparing. You can't actually tell which one is better than the other. They were done at different times. They were done in different countries. They were done with different variants. They were done in different waves. There's a whole bunch of reasons. It's like we like to oversimplify and think it's like comparing which apple tastes the best, but you're actually comparing an apple to a banana to a papaya. Like they're not even the same fruit. What we do know, looking at the data, is all the vaccines approved in Canada are really effective for severe illness, hospitalization, and death. As we head into the third wave, and as we look at the variants, as Dr. Long was talking about, that is the concern. The concern is severe illness, hospitalization, and death. So when people ask this question, it's important to reframe it. People ask, should I choose between vaccines? But we're having to reframe it often saying, you're not choosing between vaccines. You're choosing between getting vaccinated or waiting unvaccinated in a third wave with variants. So the question, the comment is, if you can get vaccinated, take the first vaccine that you can get. All the vaccines in Canada are really effective for severe illness, hospitalization, and death, and they're also safe. So the last point I'll make about safety is that it's been really interesting following the clotting concern with the AstraZeneca vaccine that came out of Europe. We've seen cases in the UK, and I had just seen that there's potentially a couple of cases in Canada. The thing that's really interesting about this is that this is science in real time. We call this post-marketing research. This is excellent that we're seeing it. These are very robust vaccine monitoring systems that are tracking very unusual, very rare side effects. So it's wonderful that we're actually seeing the system work. But the thing that's important to highlight right now, and Thrombosis Canada has some really good information. They have a statement on this. That one thing to remind people is that COVID causes clots. COVID causes a lot of clots. And about 1 in 100 people who have COVID develop a clot. 1 in 20 people who are hospitalized with COVID develop a clot. So one of the hardest parts about managing COVID is the clots that it produces. In terms of frequency for AstraZeneca, if this is in fact a side effect, and that's what's being investigated, is it a coincidence or is it a real side effect? And now are we seeing it because we're looking for it, or is it actually a real thing that's really connected to this? It's not clear yet. Even at the rates that we're seeing based on what's in Europe, it's about 1 in 250,000 people might develop a clot, which actually starts to get into the realm of birth control pills, which also cause clots in the population. And it's actually this population where this is showing up. People who are in the ages of about 20 to 50 seem to be having the side effect. That's exactly who experiences clots with birth control pills as well. So people are very worried about this, but it's really important to put it in the right context. which is that if this is in fact a side effect and we don't know for sure, it's extremely rare. If you want to avoid a clot, the best thing you can do right now is avoid COVID by getting vaccinated. And all 3 vaccines that you can access in Canada right now, and Johnson & Johnson, which will come up hopefully soon, are all really effective for preventing severe illness, hospitalization, and death, and are all safe. So I'll leave it there, but if there's questions, I'm happy to take them.
Thank you so much, Dr. Grindrod. Great explanation and very thorough. And nobody now has to ask on the call when they can hug their grandkids. So I won't ask that either.